Today I'm going to talk to you about birth doulas. What's a birth doula? Well, the word doula comes from the ancient Greek meaning female servant, though in modern Greek it means slave. A doula is someone who provides support, emotional, physical, practical, informational, and interpersonal support to a couple during labor and birth. These days, the NHS is under such pressure of resources that very few services can offer continuity of care from pregnancy, labor, and birth. And for that reason, many couples are turning to doulas to fill that gap. Now, it's important to remember what doulas aren't. They are not medical personnel. They are not medically trained, and legally they have the same status as a friend of the family or a relative. And what is it they actually do? Well, normally a doula will meet with a couple 2 to 3 times during pregnancy. They will help the couple to develop a birth plan or birth preferences. They will practice physical skills for labor and birth, things like massage or relaxation, or physical skills like positions for birth and labor. But mostly they spend that time developing trust and rapport with the couple, so that when the time comes, labor begins, the couple will feel comfortable with the doula, will feel secure and safe in her care. And that will help the hormones of birth to flow optimally and birth to proceed well. Once labor begins, the doula will come and spend time laboring at home with the couple. She'll bring with her a bag of tricks. And here are some things from my doula bag of tricks. You can see we have massage tools, we have a lavender wheat bag that can be heated up, and a hot water bottle. We have some massage oil, some essential oils, some flameless candles that can be taken into the hospital to give a good ambiance. There's a fan in case a woman gets hot, a mirror to see what's going on during the second stage, and a rebozo, which is a technique to help babies get into a good position for birth, and of course a copy of the birth plan. So the doula will spend time laboring at home with the couple, and then we'll go with them into hospital if that's where they're giving birth, or we'll stay at home for a home birth. Stay through the birth, and we'll also stay for an hour or 2 after birth to protect that golden period immediately after birth and hold the space for the couple. And then a week or a few days after the birth, the doula will have a debrief session with the couple. Now, as I said before, doulas are not medical professionals, and in fact there's no legal regulation of the profession in law, but they are self-regulated. Doulas UK is the de facto professional organization for doulas in the UK, and they recognize certain doula training as a recognized Doulas UK training, and one of those trainings is the NCT training. And in fact, the NCT training is the only university accredited doula training in the country. NCT practitioners have an NCT license to practice, and they abide by the NCT Code of Conduct. The NCT provides continuing professional development for them and covers insurance. So, do doulas work? Well, John Kinnell, a renowned obstetrician and researcher, said, if doula were a drug, it would be unethical not to use it. The Cochrane did a review in July of 2017 looking at 27 different clinical trials comprising 15,858 women, looking at the kind of care that is provided by doulas, that continuous care. And what they found was that the kind of care that doula provides increases the rate of spontaneous vaginal birth. That means there are fewer inductions. It decreased the length of labor, the duration of labor. It decreased the number of cesareans, decreased the use of forceps and Ventouse, decreased the use of epidurals, and indeed of any pain relief. It decreased the low 5-minute APGAR score. An APGAR score is a measure of how well the baby's doing 5 minutes after birth. And it decreased the negative feelings that women had about their birth experience. So yes, doulas do work. They make labor shorter, they make babies healthier, and they make mothers happier. Thank you.